and that's how you see it, and that's how a shoulder is seen, that's how the forearm is seen, and all of that. We say this is where the vessel is, this is where the nerve is, and that's how we study traditionally. It was a nightmare for us to pass these exams. You know, the medical students, they're always lost in exams and studies. That's how we study. Next one. So if we look at this, this is what technology has done today. These are all available. These are all easily available. You can go to this software and put it on your screen. You can take out layer by layer and study each of the vessels in 3-dimensional. You can rotate it, see it, and do all of that. Next slide. So this is how virtually we can see on our screens and study it. So it's improved our understanding tremendously. Next one. So this was available to study and give exams in the medical colleges. Now we are able to take this into the operation theater, and that's what has made it possible. The 3D, the virtual reality. Today I'm in the operation theater. I have to cut open the skin to see inside, right? But I can see it without cutting open the skin, what is right under the skin, what is the neck structure, where it is. We're going to demonstrate that to you today. Next one. This is what we present, a 3D AI lab, 3D surgical AI lab. This is a very advanced lab, and this is given us already, we have been using it. This has given us tremendous advantage over conventionally what we have been doing. This is what is cutting edge about the story. So in the hospital, we have this lab here. We would like you to take a walk and see this 3D lab. You'll really get the hang of what it is all about. This lab is here for my clinicians, for my doctors, every day to go see, understand it, play around with it, improvise on it, innovate on it before they do the surgery next day. And that's the power of having this here. There is technology in the world, there is doctors in the world, but both of them don't meet each other. The whole endeavor is to get everybody on board so that we can get better. And I told you the need of precision, customization, and error-free surgeries. Next one. So a lot of times patients say, you don't explain to me what you're doing. This virtual reality, we put the glasses on, it'll show them exactly what are we going to be doing and precisely how we can do this. Next one. So in the operation theater, this picture is in the operation theater. I'm wearing this virtual reality glasses and I'm ready for surgery. I just turn around and look at it. I can see the 3D model. I have gadgets in my hand to play around, turn it around. If I'm looking at the thoracic cavity, I can go from underneath and look at what is through the lungs, where it is. Eliminate the structure which are not required. We'll show that to you. And that's what we can do. We just turn around. It's like a computer on your eyes. You can see hospital data, patient's history, the MRI scans as they are, all of them visible to you where we are. There is AR, VR, augmented reality, virtual reality, very loosely used terms. Augmented is you see something and you augment it with some data. Virtual reality, there is nothing, you put everything there. But what we are talking about is mixed reality. That's where the world is going, where we have augmented, virtual reality, and in the operation theater in real time, helping us to deliver precise, error-free, and customized care. These are the three buzzwords. Next one. This is our lab. It's in the second floor. We'd love you people to go and visit that, and you can wear the virtual reality glasses and experience how we as surgeons can look at this and what really recently. And you can see the patient, the entire picture of the patient. We use the hand, we rotate and see where exactly is the thigh bone, where exactly we have to reach from, and how do we operate, and what is the size, what is the shape, and what exact implants you need. All these are wonderful things. As a surgeon, it's very exciting. My team is super excited about what we are able to do. Next one. Can you imagine this? Like in the books, what we show, this is a real patient. We have superimposed the entire segmented pictures onto a patient in the operation theater, and you can see it real. These are all real size with accuracy of 99.99%. That's how accurate it is. And when you do that, you are really walking along the safe corridors. Next one. So this is not just just dramatic. This is not a movie. This is not something which we are doing for the effects. This has been reviewed by the peer reviewed and clearly shown the gain we have by using these technologies. And I think this is the future of orthopedics, and this is the future of medical science. This is the way we are going to go. Next one. Mayo Clinic, Cleveland Clinic, Hospital for Special Surgeries, Johns Hopkins, Singapore General Hospital. These are the hospitals which are doing a lot of work in this area. And these situations have to be challenged by complex answers. I've had occasions when I had situations where I needed to know precisely. I've sent images and everything else to these places, and they will print out a model and send it back to me. It costs on an average 20,000 US dollars, and it takes 3 months for them to come back with the image, with the 3D printed models. Today, we are able to do this here and now at 1/10 the cost. It costs 2 lakh rupees for us to do a 3D model which you can play around and take it into the operation theater and cost you as little as that. And if we can do it in no time, overnight we can do this. And that is the power we need to have here and now and not depend on everybody else. It's pioneering. That's why we think it will go a long way in achieving the goals of precise, error-free and customized medicine. 3 days ago, correct Suraj? 3 days ago? Yeah, Suraj is our ortho-oncosurgeon. He operated on this patient. Can you see? It doesn't take a medical man to see. He's got a large tumor on his chest. This is a cancer. This is a fibrosarcoma. This is quite a difficult situation, but today our surgical expertise and all this advancements will give him a full life. I can tell you that confidently. But when we are operating on this, so many things can go wrong. Typical situation, right? Next slide. 3D printing of this, right? You can see the chest wall. What you see in the green is the tumor. That is the fibrosarcoma. An MRI scan showed us this is the tumor which is sitting here. And exactly in the same place, just to be technical, there is a vessel called subclavian vessel. And if the subclavian vessel is a complete, it is the lifeline of the entire arm. If subclavian vessel is not there, arm can't exist. That MRI scan showed us the subclavian vessel is going through the middle of this tumor. If it is going through the middle of the tumor, I cannot take out this tumor without taking out the subclavian vessel, right? Sorry for being so technical, understand what I'm saying. And earmarked it, this tumor was separated from that subclavian vessel, what you can see in green. We confidently could go in, remove this tumor in its entirety without leaving any of the cancer cells behind, and save that vessel very, very confidently, because we could see this. We could see this much before we did it. And what we can tell the relatives and all of them is very different. How a young surgeon can be adventurous because he's so sure of the anatomy. That's what the insight is. Next, virtual reality glasses. I'm seeing it live, how it is. And I can see the MRI scans, I can see this, I can see the vessel, and go and execute the plan. The next one. That was inside the operation theater. That was after the entire tumor is removed and he's got a skin graft. It's gone. It's gone. And this man, productive young man, can live a normal life and take care of his parents and children and be a great contributor to the society we live in.